Cranial nerve 4 is known as the trochlear nerve. And the trochlear nerve is another nerve that innervates a muscle that moves your eye. So again, same picture here showing the 3 cranial nerves that innervate muscles that move the eyeball. We just did oculomotor nerve, and it controls 4 muscles that move your eyeball. Well, there's 2 other muscles that move an eyeball. Trochlear nerve controls just one of those other 2. Trochlear nerve is only motor. It's known as the smallest cranial nerve. So this is a very small nerve. It innervates one small little muscle. That one small little muscle is known as the superior oblique muscle. So this is another muscle that moves the eye, but it runs on an angle to the eye. And the reason why this nerve is known as the trochlear nerve is the superior oblique muscle uses a little pulley right about here known as a trochlea. So the muscle actually comes from back here, way behind the eye. It goes through a little loop or a little pulley known as a trochlea, then angles back on that angle to the eye. And this muscle, when it's stimulated by the trochlear nerve, causes depression of the eye, so it helps you look down, but it also rotates the eye to the inside. So kind of like if you were looking at your nose. When you look at your nose, that's using the superior oblique muscles of each eye. So that's just a small little nerve controlling one little muscle of the eye. Trigeminal nerve is cranial nerve 5. Cranial nerve 5 is the largest cranial nerve. It has a very large portion that's attached to the brain. And that nerve will then divide into 3 branches. So the trigeminal nerve has 3 branches. The branches are the ophthalmic branch, the maxillary branch, and the mandibular branch. The trigeminal nerve is a mixed nerve. It has sensory components, which is mostly sensory of the face and the oral cavity. Specifically, that mandibular branch will go into the oral cavity. So the areas of the face that it innervates, it transmits touch, pain, and temperature. So notice the ophthalmic branch innervates the skin around your eye and of the forehead. The maxillary branch innervates the skin below the eye, your nose. And then the mandibular branch innervates the skin that covers your mandible. So each of the branch innervates those 3 regions of the face. So that's its sensory function. The motor function is stimulating muscles of mastication. So mastication obviously is chewing. So you can see branches going to the temporalis, which is a muscle of mastication, the masseter, and the pterygoids. And it's actually just the mandibular branch that innervates muscles of mastication. So this nerve is the only cranial nerve that goes to the skin, and it just goes to the skin of your face. Now be very careful when you see the word face, because there's another nerve called the facial nerve, but it's the trigeminal that is the sensory of the face. Cranial nerve 6 is the abducens. We're back to this picture again, where we're looking at muscles that move the eye. There's one last muscle that moves the eye. That last muscle is known as the lateral rectus muscle because it sits on the lateral side of the eyeball. Now, I notice that this is a complete mistake again. It does not innervate the superior oblique, so cross that out and cross out depress the eye. But instead, it innervates the lateral rectus muscle. And the lateral rectus muscle causes the eye to abduct or move laterally. So you'll notice the name of the nerve, abducens, tells you what it does. It stimulates a muscle that causes the eye to abduct or move away. So that's the abducens nerve. Cranial nerve 6. Next one, cranial nerve 7, is known as the facial nerve. The facial nerve is a mixed nerve. It's got sensory and motor. The sensory portion is not of the face. I will repeat. The sensory portion of the facial nerve is not of the face. It's of taste buds at the anterior 2/3 of the tongue. So we're going to see that when we learn taste, there are 3 nerves that transmit taste. This is one of them. But it only transmits from the taste buds at the tip of your tongue, the anterior 2/3 of the tongue. So that's its sensory portion. It also, from that part of the tongue, will transmit touch, pain, and temperature. So if you bite the tip of your tongue and that pain, that's going to your brain via the facial nerve. The motor portion of this nerve is muscles of facial expression. So that's where it got its name, facial nerve. Not for sensory of the face, but for facial expression. So you'll see it innervates a lot of the facial muscles. Frontalis, zygomaticus muscles, the muscles that act on the mouth and the lips. Those are all facial muscles, so facial expression. It also stimulates a couple salivary glands. So this salivary gland here under your tongue is called the sublingual salivary gland. This salivary gland down here is called the submandibular salivary gland. So it stimulates saliva production, and then it also goes and innervates the lacrimal gland to stimulate tear production. Neuropathy of this nerve can lead to what's known as Bell's palsy. Bell's palsy will affect facial expression, so the face will droop. It usually is only one side of the face. So inability to kind of smile and have facial expression on one side. These people often experience dry mouth due to lack of saliva production. They also experience dry eye due to the lack of tear production. So that's known as Bell's palsy. Cranial nerve 8. Cranial nerve 8 is strictly sensory. It's your hearing and equilibrium nerve. When we get to hearing and equilibrium, we're going to learn that the structure involved in equilibrium is called the vestibule, or the vestibular apparatus. So it's got a branch for equilibrium called the vestibular branch. It's got a branch for hearing. When we get to hearing, we're going to learn that the sensory neurons for hearing is found in what's known as the cochlea, which is kind of this spirally looking structure in the inner ear. So this is the nerve for hearing and equilibrium. Cranial nerve 9 is known as the Glossopharyngeal Nerve. If you look at that name, glosso refers to tongue, pharyngeal refers to your pharynx or your throat. It's a mixed nerve. It's got a lot of function. 1, it's another nerve that transmits taste. So it's got sensory neurons at the posterior 1/3 of the tongue. You'll see that right here. Posterior 1/3, those taste buds transmit via the glossopharyngeal nerve. It also monitors blood pressure and blood chemistry. So monitoring blood pressure is very important. We need to know whether pressure is too high or too low. We also need to monitor blood chemistry. Blood chemistry is oxygen levels, carbon dioxide levels, and pH levels. But this nerve monitors at the carotid arteries. So this big artery going up your neck is known as the carotid artery. And this glossopharyngeal nerve is monitoring blood pressure and blood chemistry at the carotids. Motor function includes stimulation of saliva. So this is the second nerve that can stimulate saliva, but it goes to this salivary gland back by your ear, known as the parotid salivary gland. Parotid actually means near the ear, because you have one large salivary gland back here. It also innervates muscles that are involved in speech and swallowing. That's another motor function of the glossopharyngeal nerve. The next nerve is known as the vagus nerve. The vagus nerve is your longest cranial nerve. It's typically not called the largest. Remember, that was this one here, the trigeminal nerve. But the vagus goes the farthest of the cranial nerves. It's going to go down and innervate organs in your thoracic cavity, like your heart, like your aorta. It's going to innervate the respiratory tract. It's going to go into the lungs and innervate your airways in the lungs. It's going to continue down and go into the abdominal cavity and innervate a number of organs in your abdomen, like your liver and gallbladder, your stomach, your intestines. So this is the only cranial nerve that continues down below the neck and goes into the thorax and abdomen. And because it goes long distances, it got its name vagus. Vagus comes from the word vagrant. A vagrant is often called a wanderer. So anything to do with organs in your chest or abdomen, if it's cranial nerve, it's the vagus nerve. It has sensory neurons and motor. The sensory deals with sensations, touch, pain, temperature in these areas. Taste, it's the third nerve that transmits taste, but it's way at the back. So we have taste buds in our throat, and you have taste buds on your epiglottis. So it gets the taste sense from way back there in your throat and epiglottis. It monitors blood pressure and blood chemistry, much like the glossopharyngeal nerve, but different location. It monitors at the aorta. The aorta is this large artery coming out of your heart. So here is where the vagus is monitoring blood pressure and blood chemistry. These are those carotids, and that's the glossopharyngeal. So both vagus and glossopharyngeal monitor blood pressure and blood chemistry. Number of muscles involved in speech and swallowing. Smooth muscle of the lungs, so it can regulate airway diameter. It also innervates the GI tract. For example, your stomach is stimulated by the vagus nerve. So when it's time to digest food in the stomach, the vagus nerve will stimulate stomach secretions, enzyme production. It'll also stimulate the muscle of your stomach. How it affects the heart. It innervates the heart, but its job is just to slow your heart down. So the vagus nerve slows your heart rate. Other nerves speed it up. The vagus nerve slows it down. And then again, it stimulates digestive glands, such as in your stomach. So the vagus nerve does a number of things. Of the 12 cranial nerves, this is the one you're going to hear about more and more, especially when you get into AMP2. Next one, cranial nerve 11, is strictly motor. It's known as the accessory nerve. It's a little different than the other cranial nerves in that it actually does attach a little bit at the spinal cord. So it's got a cranial component that attaches to the medulla, and it's got a spinal component that attaches to the spinal cord. But ultimately, this nerve goes to two muscles, sternocleidomastoid and trapezius muscles. So it helps to coordinate head movements. It also helps you to elevate the scapula, because that's what that trapezius is doing. So to test this nerve, we often have a patient do a shoulder shrug. Just kind of shrug their shoulders and see how strong those muscles are. Finally, cranial nerve 12 is called the hypoglossal. Hypo means beneath or underneath. Glossal refers to the tongue. It innervates underneath the tongue. It innervates a number of glossal muscles, muscles that move your tongue. For example, this one here is known as the genioglossus muscle. That muscle there helps you stick out your tongue or protract your tongue. And that's how we can test this nerve. We can ask someone to stick their tongue out. And if that tongue doesn't come out straight at the midline, maybe it's angled to one side or the other, that could actually mean this nerve is damaged. All right, last thing, there's a table here that talks about assessing cranial nerves. I'll probably talk a lot about this in class when we meet. But each cranial nerve, there's a test to help us determine whether that or those cranial nerves are functioning. And typically you have to assess the right side and the left side separately because you have, again, pairs of each of these 12. But you can kind of look down this list. We'll go over this a little bit in class, but obviously some of them are pretty straightforward. You can test the olfactory nerve by having the patient smell something. Usually they will then have to identify maybe what they're smelling. So you give them something that most people know what it smells like, maybe cinnamon or some scent, some spice, and they need to be able to tell you what that is. Optic nerve can be tricky because a lot of things affect your vision, but usually if someone's having trouble with their vision, we're going to look at all kinds of things, whether it's the lens or the cornea or a number of different things can cause visual impairments, but there are also tests that we can use to look at the optic nerve. Oculomotor, we look at eye tracking, movement of the eyeball. We look at the pupillary reaction, see if it's constricting in response to light. We can also observe the eyelids. Trochlear, we do eye tracking down and medial because that's what that trochlear nerve will stimulate. Trigeminal nerve, since it innervates muscles of mastication, we can test how strong their bite down is, or we can also test their sensory function on the face. Abducens is eye tracking. We have them look side to side, but what we're doing is looking at the eye and see if it's moving laterally or is it abducting. Facial expression is a pretty easy one to test for the facial nerve. Hearing and equilibrium for the vestibulocochlear nerve. Swallowing and gag reflex for glossopharyngeal. Vagus nerve, we actually can look at the uvula when someone says ah and see if that uvula is in the right position. Accessory nerve, test shoulder shrug. And then finally, hypoglossal nerve, we can ask the patient to stick their tongue out. So I went through that pretty quick, either because we've already talked about it in class or we will talk about these signs of cranial nerve dysfunction. In class, I'm going to do a drawing that'll help us, remember how we assess many of these cranial nerves, but we'll do that in class.